Normal delivery is a natural delivery and it's been going on for thousands of years. It's been going on since life started on this earth. Hello everyone, I'm Dr. Sarbani Ghosh. I'm a senior consultant gynecologist attached to the Bhagirathi Neotia Women and Childcare Center, Rawdon Street. I've worked in many places in India, in the United Kingdom. I've got my post-graduation degrees from London. And normal delivery is a topic which comes up very frequently, and we have to answer information regarding this to many of our patients. Now, you see, normal delivery is a natural delivery and it's been going on for thousands of years. It's been going on since life started on this earth, and it is basically a spontaneous labor which ends with the delivery of the fetus without any medical intervention. But it is not so simple and straight cut nowadays. We do have certain assistance. So let us consider today what are the things we should look into before we say that this patient should have a relatively easy and safe normal delivery. Because at the end of the day, it's about a safe mother and a healthy mother and a healthy baby and a safe birthing experience. Regarding normal delivery, we consider three things: the passage, the passenger, and the power. Now, the passenger is of course the baby. So before normal delivery can start, term starts from 37 weeks onwards. Now, the baby has to be lying longitudinally with its head down, and if you divide the head into 5 imaginary parts, 3/5 of its head should be inside the pelvis. Like the pelvis is like an egg cup and the baby's head is like a hard-boiled egg. So if you imagine that, most of the head is gone in. So 2/5 of the head only should be palpable. This is called engagement. So the baby is lying in a straight position, most of the head has gone in, and its attitude, like the smallest diameter of the head has to go in. It's not just walking, opening the door and walking straight out. There is not enough space for that. There is only a few millimeters difference between the circumference of the head and the diameter of the pelvis. So yeah, the baby has to manipulate its head to fit into the pelvis. Plus, we have to have that regarding the passenger, as I said, the presentation and the size of the baby, because if the size is too big, it's not going to fit in. Now, regarding the passage, of course, we have to ensure with our hands, by a clinical examination, that there is a proper enough space for the baby to come down the vaginal passage. And power, yeah, that there should be good enough contractions. Of course, this is one thing where we can help with medicines. Now, there are 3 stages of labor. The first stage of labor in a mother who's going to be for the first time primigravida lasts anywhere up to 18 hours or more, and it can have very painful contractions. Of course, we do have painkillers to help with that. Nowadays, we also have painless labor where we have a epidural anesthesia, where normally the patient can feel very little pain. And the second stage of labor, where the baby is pushed out, and ultimately the third stage, where the placenta, the afterbirths are pushed out. So how do we decide, how do we assess who are the ladies who are suitable for normal delivery? See, the most important thing is the lie of the fetus. How is the baby lying? The baby has to lie straight and most of his head has to go inside the pelvis. It's like, you know how you put a boiled egg inside an egg cup and most of it has gone in. This is called engagement, and this engagement has to happen by 37 weeks for the mother who's going to be a mother for the first time, because the position doesn't change much after this, and normal delivery is not possible without proper engagement. Apart from this, of course, there should not be any complications in the mother and fetus. Regarding good contractions, of course, we do have medicines which can take care of that. Now, you do understand that the person who is attending the birth, the doctor or midwife, has to be very alert to spot any deviations from the normal. Is labor progressing as it's supposed to be? Is the baby's head going down as it's supposed to be? Anything away from normal, there should be prompt action taken, because this is a dangerous journey, possibly the most dangerous journey a baby will ever undertake. It's a critical time for the mother and her family. It's something they have been anticipating for 9 months, but with proper assessment, with proper monitoring, with proper care, it is possible to make this birthing process a very safe and memorable experience.